Yep. Right. Okay. So let's look at the assignment.
Okay.
The best what we need to do is so today we're going to understand the assignment and
Oh,
try to understand what is expected of you. Uh, and then I'm going to provide you some material which will help you to understand the assignment. And
okay.
then, yeah, then I also give you a template for a lesson plan because those are the two things you need. Okay, so
Mm-hmm.
you need to understand why discharge is important. So you are talking of discharge planning. Okay,
Yes.
yeah, so you need some knowledge of that. But first, let's look at the assignment and try to understand it. Okay, and you should be asking questions as we go along. If you need to write, you can write the notes. It's up to you. Okay.
Okay.
Yeah. Okay. So now this is your assignment brief. That's what is important. Okay. Now,
Yes.
yeah, most of the students they end up thinking, oh no, I need a um, marking criteria, and they use marking criteria to do the assignment. No, that's not going to help. No. All right.
Okay.
So you have a peer teaching session. So this is a peer teaching session. Okay. Right. So that's the first important. Okay. And then
Mm-hmm.
what it says here, you need to critically plan, okay, learning event. So that's what they want you to do. They want you to plan a learning event, which is supported by a range of theories. Okay, that's learning theories, how people learn. Okay, so because we learn in different ways, then what you're assuming here is that of your the group of your participants will
Mm-hmm.
have different learning style. Okay, therefore you need to cater everybody. So group have different learning style. Okay,
Yes.
yeah. So therefore, where do you get this? I'll send you the material later on to see. You don't need all of them. There are many theories of learning. Okay.
Uh-huh.
Yeah. So, but you don't need all of them. Okay. You only need to use the ones which are going to be you're going to use for your own teaching sessions. So, for example, if you believe that people learn through experience, okay,
Mm-hmm.
so which means they need to work with something. Therefore, you're going to see that immediately changes the way you deliver this lesson. So you are going to develop activities for the people to do.
Mm-hmm.
Do you follow?
Yes.
Yeah. So this is the way you develop your lesson plan. So yeah, people obviously they will learn better if they have got if you actually involve them in doing, which means experience. Therefore, you need to develop the activities that they need to use within their teaching session. Okay.
Uh-huh.
If you believe that people learn by actually being communicated, which means being talked to, being told what, giving them information, then you're going to have a presentation. So that's why you have PowerPoint presentation. So presentation, you're assuming people they actually learn by actually receiving the information, and then they interpret that information, evaluate it, and then they use themselves. Okay.
Mm-hmm.
Yeah. If you believe people learn a lot by actually using their eyes, okay, which means they
Mm-hmm.
prefer to see, to observe. So you are going to develop with demonstrations yourself, and the rest of your students are going to be observing. They are seeing what you're doing. So they can learn it by looking at what you're doing. So you're going to have a lot of demonstrations within your tutorial. So each of these is a theory. So you need to back up why you have included this activity. Why have you included this activity? Why have you included this activity? That's the idea behind it. So you are justifying. Okay.
Yeah.
Yeah. So there's no way you can cover all the learning theories. No. Okay.
No.
Yeah.
Okay.
Yeah. The teaching methods will depend on these activities. So this is more delivery self. So you can see the moment I think, oh no, I think people need to be talked to, need to be given information. Then the method I'm going to use is a presentation. So I'm going to develop a presentation, which is a PowerPoint presentation, and then deliver to them. If I believe that they are obviously they need to have activities they need to do by doing, which means I need to develop skills and competence in them, then I'm going to give it some activities for them to do. So the method is going to be uh, doing the activities. So you have planned activities that they need to do. Okay.
Okay.
Yeah. So it's going to make sense as we go along. But let's look at some of these things that obviously you need to know. Okay. Now the first you need to think of, are you going to have a group or are you going to have individual?
Mm-hmm.
Yeah, so it's not going to be one to one. Yeah, you are going to have group. So if you're going to have a group, it does not necessarily mean you need to use a group, but the choice is yours. So I
Mm-hmm.
remember the target group is newly qualified nurses, isn't it?
Yes.
Yeah, so the target group, okay, is newly qualified nurses. Okay. So then you need to ask yourself, why this group? So don't just say, yeah, I'm going to target newly qualified nurses. But the question is why? So you need to justify.
Mm-hmm.
Yeah. So they're most likely when we read some of the notes that we're going to go through together, part of it, you will realize that probably you are thinking that this group of nurses probably they missed it in their curriculum because they're at the end now. So you are saying they are graduated. So you feel
Yes.
that, yeah, the discharging planning was not a part of their curriculum. So you have seen
Mm-hmm.
there's a gap in what they covered. Okay. So, but at the same time, you believe that one of the most important activity they'll be doing, or some of their role they're going to have, is planning the discharge, so that they can manage the bed capacity of the hospital.
To manage the bed capacity.
Yeah, that's
Okay.
that's one of the reasons why you do discharge planning.
Uh-huh.
Yeah, it's managing bed capacity in the hospital. You don't
Uh-huh.
want the to have more admissions, less beds, which means the people will be sleeping on the floor.
All right.
Yeah, so it doesn't matter whether it's elective or it is acute. Acute means emergency. Yeah, you will see when I go through some of the notes, you will see why it is. Yeah,
Okay.
all right. Okay, so that's that. So in your case, it's going to be a group. So you're going to see if you're going to have a group of these participants, then you're going to have group activities, okay, not individual activities. So
Uh-huh.
it helps you to choose the methods you're going to deliver some of the activities.
So
Yeah,
how do I do that? Uh-huh.
you develop yourself. You need to think what activities I need to give them.
Okay.
Yeah, that's a part of you thinking now. So for them to learn, so for example, they're going. So you want them to learn how to plan discharge. That's what you're trying to do. Okay.
Yes.
So how do they plan discharge?
Discharge.
Okay. Yeah. So what you can do, you can see here. Okay. You can actually give them a question which they need to discuss as a group. Okay.
Uh-huh.
So for example, you can say why planning discharge is important, and then you give them time for them to discuss. So they're going to come with various reasons. Yeah. But you will see that the main one is actually to manage the bed capacity so that
Uh-huh.
the ward is not overcrowded. Okay. There are others which you obviously, if there's going to be that planning of discharge, it also helps you to deliver more satisfying services to your patients, because patients don't want to overstay in the hospital. No.
Uh-huh.
Yeah. Yeah, because some of the patients, especially in the modern days, not during my time, the modern days is, and also where you are here. So most of these people they live far much longer. Yeah.
Uh-huh.
Yeah. So because they live much longer, don't necessarily that they're going to die today. No. but they're going to have quite a number of complications associated with whatever they went for in the hospital. So, for example, if they went for surgery, you will realize that when they come out of the hospital, then they are going
Dr.
to.
Can I just stop you for a minute?
Mhm.
Because what I can do is
Mhm.
that as you're talking, if it's recorded, would I be able to go back to this recording?
You'll be able to go back. That's what I said. But
Okay.
yeah, you don't need to. All you need is writing things that I'm adding, which you think is going to help you to explain. Okay.
Okay. All right.
Mhm.
Because I wanted
Yeah.
to start recording on the side. Sorry.
No. You don't need that. Okay. Right.
Right.
So you will see some. So what I'm saying is, so where you are living here, okay, people, when they were maybe in their middle age or their younger age, their houses are slightly different from now when they are old. So they end up adapting or changing the structure of their houses. So, for example, yeah, most of the houses here they have a bedroom upstairs, okay, and they have kitchen and dining room downstairs. Now, most of your people here, when they're getting older, the number one most important problem is going to be their mobility problem. So because they have hip difficulties or they have hip replacement, so realizing that because of mobility problem, they can't move all the way from the top going down to go to the toilet. So what do? You have to adapt the house. So you find the house has got what do you call these things which they move people up and down. They're just sitting in it.
Yeah.
But also, as they are growing older, they have complex problem which require multidisciplinary team. So you need a number of different professionals because you may need someone who is a occupational therapist. You may need someone who is going to provide medicine. You may need someone who is going to provide them with meals. So all these, you see, they need to be arranged before the patient is discharged. Yeah. So that's why discharge plan is extremely important. Okay. Apart from just about the beds. Okay.
Okay.
Right. Okay. Right. So let's yeah. So mostly at the moment, just try to understand this assignment. What this assignment is. So as I say, so event is actually is going to be the discharge plan. That's what you want to look at. Yeah. Okay.
Yes.
Your target group newly qualified nurses. So you need a reason. Yeah. So you need a reason why you are targeting this. Okay. Yeah. Okay. So which means if one of the activities for if you want to evaluate whether they have understood, because also you need to evaluate how are they going to how are you going to evaluate that your lesson has been effective, has actually been successful. Yeah. One of the things is to allow them to develop a discharge plan at the end of your session. Yeah. Yeah. That's what you can do. Okay. All right. Okay. Nice. Let's go down. Okay. So it says prepare. So prepare and facilitate. So you can see you need to prepare and then you facilitate. This is wrong. It should be an engaging, okay, and interactive session. So very important. So engaging means your participants always need to be alert. So you need to find a way of making them always alert so that they can participate. Yeah, interactive, which means they need to contribute, not just sitting there. Yeah? So giving them activities, giving them group activities where they're discussing will help these people to be more interactive. Okay. Yeah. So that's what you do. Then you're going to have a plan. So in your case here is a lesson plan on discharge plan. That's what you're. Yeah. That's okay. All right. Okay. The rest is actually directive, what you need to do, instructions. But let's go down. So you say, what do I need to do to pass? Okay. So I don't know what some of these words seem to be easy, isn't it? They tell you what you need to do. Facilitate a 5-minute interactive session. So it has to be interactive session. Okay. And provide an accompanying lesson plan. So you're going to have this lesson plan, which in your case is going to be a discharge lesson plan. Okay. Then it says contextualize the intended participants and setting. So in your case here, you have already. So this here is your newly qualified nurses. Okay. Yeah. And then we need to know where they are. So the setting, are these in the hospital?
Yes.
Yeah. So that's your setting. So you need to indicate it here. So your setting is hospital. Okay. You can also have a specific ward of the hospital. It's up to you. Okay. Then it says clearly articulate the intended learning outcome of the session. Okay. So this is extremely important because it's going to be also in your plan. Okay. So this will come back to it. Okay. Because it's extremely important. We'll come back to it once we have covered something else.
Okay.
Outline how you will evaluate. Remember when I was saying evaluating the participants' learning? Okay. So how will you know the participants have learned? Okay. Now you are being evaluated to see whether you have learned, you have understood what you learned. One of the things they have done is to give you this assignment. Yeah. They're assessing whether you have achieved this intended learning outcome. Okay.
Myself personally.
You yourself, yes. In your class, this is one of the assessments they have given you. The teacher wants to see whether what they taught you have understood, which means learning has taken place. If you can't succeed in this, it means learning hasn't taken place. So we are talking about the evaluation of the participants.
Is this for me or my newly qualified nurses?
No, I'm saying example is you yourself. So you yourself, yeah, you are being, the teachers are evaluating you whether you have learned. So it's similar. You also need to evaluate these nurses whether they have learned what you want them to learn.
Yes.
So in your case, they have given you this assignment. It's a part of the process of evaluating. Now, in your case, you're going to give them opportunity probably to develop a discharge plan. Yeah. So if you want to evaluate them whether they have understood what you are teaching them, then give them a chance to develop a discharge plan, and you use that to assess whether they have understood or not. Yeah. Okay. Right. And then the next it says, how do I produce higher quality work that merits a good grade? Again, yeah. So they are telling you what you need to do. That's how life has become easy in modern days. Yeah. Okay. Right. So we need to have clear aims and we need to have objectives for your teaching sessions. So start thinking that. Okay. So what are the aims of your okay? This is the aim, and we need the objectives, and we need intended learning outcomes. Okay. And then it says perform with confidence a clear and engaging session. Now, this you are not going to demonstrate here because you are just writing and send it. Okay. Yeah.
Yeah.
They can tell from the narrative that you're going to provide, because you're going to be providing narrative, which means the things you'll be talking if you were actually delivering this session. Okay. Well presented and clear presentation of your plan. So this again is on a paper. So as I said, I'm going to show you some of the template you need to think of.
Okay.
Yeah, show clear understanding of your target audience. Yeah, so these are newly qualified. Now, how do you show that you understand them? One of the things I've said is probably you have seen they have a gap in what they covered. So you need to have a knowledge of what they covered. So you feel that one of the things they missed during their years of training is that they did not cover discharge planning. So it was not in their syllabus. Or if they covered, but they did not cover practical aspect of it, or they didn't cover in detail. So you want them to cover in detail. Or the other way is that they have covered but generic, and that's normally what we do when we are being trained. We are trained generically, yeah, in general, because we don't know where you're going to fit. So when you go to the ward, each ward is different. Okay, so therefore you need to run a training, which means you need to see how you can adapt your lesson you learned at school or in class to the actual practicality of work. That's what we're trying to say here. Okay.
Okay.
Yeah. All right. Okay. So show an appreciation of factors that may affect learning, including learning environment. Okay. So obviously here you're going to demonstrate in terms of where are you going to put your training, where are you going to run this training? Because if the training is in a place where it's not quiet, it's very noisy, it means they're not going to follow you all the time. They'll be disrupted. Yeah.
Yeah.
But also the environment, which is very hot, yeah, they are not good. They will be sleeping instead. Yeah. Yeah. So they're talking about the room where you're going to conduct that training. They make sure it is comfortable. They have plenty of water, plenty of snacks. Make sure they have it's not too hot. Okay. Yeah.
Yes.
Yeah. Because those are going to affect their attentiveness to learn. So therefore, it affects the learning. Okay. Now it says, how does this assignment relate to what we are doing in scheduled sessions? So all planned and guided learning sessions will support the development of this. This assessment, in a sense, what it is saying is that it covers all the modules that you're going to have, because most of the cases you need to have a knowledge of planning. Okay.
Okay. So assignments is going to, how does it relate to? We are doing in secluded sessions. So it's to cover my own learning, yeah?
Yeah, in here, what is saying is that all your learnings or all your sessions, yeah, in most cases you are going to be doing. So here you are developing skills of how to plan. So you realize that every module that you're going to do, you need to plan for yourself. Otherwise, you're not going to succeed.
Okay.
Yeah? So you are developing the skills, the competencies of how to plan. So don't just look at it as this is just for assessment for marks. No. Okay. Yeah. That's why you see there. So this is what you're going to achieve. So it's learning outcome number 2. This is the change that they expect you to go through. Okay. So you should have ability to critically plan learning events. Okay. And not just planning them, justifying by using the theories, the relevant theories. Okay. And also the teaching methods.
So in my plan, do I put the theories in there as well?
The theories are going to be supporting. Yes, you can't write something without. Okay. I've just said here. So if you put it, for example, okay, one of the theory you learn is that people learn in different ways, or there are different styles of learning. Okay. Now, that theory has been proven that all of us, we do not learn in the same way. Others are best at seeing the things. They can learn by seeing the things. Others can learn by listening. Okay. Others can learn by talking. Okay. So all these, others by feeling. So therefore, what you'll be doing is that you are assuming now, because people learn in different ways, it means this group of people or group of nurses you're going to teach, they have all these different. So you want everybody to make sure that he is able to participate, is able to listen, is able to understand. So you're going to have different activities within your teaching.
Okay, I now get it. So, for instance, we can do a group chat and break it down by actually doing a demonstration on how they can actually write a plan.
Yeah.
Or we can also ask them to say people coming up and talking, and seeing how they look at the discharge plan and whatever from different aspects of groups.
Yeah.
Okay.
Yeah. So the question is, why have you done that? The truth is because you have learned that the people have different learning styles. So
learning style.
yeah, in this group of nurses, it's more likely because there are more than one, they cannot have the same way of learning.
Same way of learning.
Yeah.
Okay.
Yeah.
So this is how you actually say, you put in your lesson plan three. So it says 3 different types of activities.
Yeah.
Okay.
Yeah. Yeah. So you were saying, so based on the theory that the people have different learning styles, therefore I have used the different activities in this particular lesson. Now that is going to show in your lesson plan.
Okay.
Yeah.
Yes. Okay, I understand. So when you say a lesson plan, you just divide it up to say, okay, we'll have a group activity, we'll have a break, then we'll do an observation activity, then we'll do this. So you're actually showing that in your lesson plan.
Yes, this is how lesson plan look like.
Okay.
This is how the lesson plan look like. So you have time, you have content, and the teacher activity, and then you have student activity, and you need the resources.
Okay. Content and teacher.
Yeah, don't worry. I'm going to send this to you, so don't worry about
it. Okay. Yeah. Now I don't understand resources.
Resources, you need it. So, for example, if you're going to do presentation, what do you need to do the presentation?
I'm a little bit lost there, Doctor. Sorry, to be honest.
Okay, right. So there, let's take yourself there. You are going to attend the tutorial, isn't it? So you're going to attend this tutorial class. What did you need in order for you to attend this tutorial class?
I need resources.
Yeah, but what are those resources?
Well, first of all, I should be able to get there.
No, you need a computer. You need a computer. That's where you are. You have a computer in front of a laptop. So you need that laptop. You need the internet. And then obviously you need the software in that particular internet, which you have been able to access your tutorial.
All right. Is that simple?
Yeah. You have a desk where maybe you have put your laptop or where you are sitting comfortably. Yeah. So all those are the resources that help you to deliver, to actually attend the tutorial. Without those, you wouldn't.
Okay. So you would need handouts.
Yeah.
And you will need, of course, the PowerPoint presentation.
Yeah, you need PowerPoint presentation. You may need USB. Yeah, if you are not going to have those, you're not going to deliver the lesson.
Okay.
Yeah, and you need a space where people, maybe in that space you need chairs. Yeah, I've also said you need the water. Make sure you may need the fan if it's warm. Yeah, so yeah, those are what are the resources. Each of the activity you're going to deliver require different resources. Okay.
Oh. Okay.
Yeah. So you think through those. Okay. Right. Okay. So what we need to do, right? Okay.
Yes.
I know these things. Time goes faster when you are busy. Okay. So let's cover. Yeah.
Okay. Okay. 16:30.
Okay. So let's cover this first. Okay. Which is going to add some bit of notes, some bit of knowledge to what you are doing. Okay. Now, within this, you will have links so you can access additional things. So that's not a problem at all. Okay. Again, you don't need to type a lot, but obviously just concentrate. I will send this to you, so you don't have to worry. Right. So this is your topic. Okay. It's discharge planning. Okay.
Yes.
Yeah, but you need some knowledge why discharge planning is important. Okay. Right. Because that's what you're going to be telling these nurses. Okay. Yeah, why should they engage in discharge? Yeah, planning. Okay. Right.
Yes.
Okay, so let's look at it together. So it says, what is it? Okay, so you need a definition of what discharge planning. Even in your presentation, that's what you need. Yeah.
Okay. Yeah.
So it's a specific targeted discharge date. and the time. You can see immediately the moment you have done that, what would be the benefit? It helps the patient, okay, reduce the stay, okay.
Okay.
Yeah. It also prevents the emergency readmissions and reduces the pressure on the hospital beds. So it's a bed capacity management.
Okay.
So it says this is the case for all patients, from those having day surgery through to those with more complex needs. We need to plan. Okay. There is always the pressure on inpatient bed. Okay, so that's why most important. So there's always pressure on inpatient beds, and the better discharge planning can help to reduce the length of stay and increase throughput.
All right.
Okay. Yeah. As I said, don't write it. I will send this. Okay, I will send it. Don't worry.
Okay.
Concentrate on your understanding. Okay. So
Okay.
it says, when do we use it? Okay, right? So when do we use it? Yeah, discharge planning is a key part of operational management of beds. Can you see? That's what I was saying. It's a bed capacity. Okay, so you're trying to balance the admissions versus the discharge, because to admit you need the beds, and every hospital has a capacity. A capacity is the maximum number of beds that can be occupied per hospital. Yeah, you can't change that, because if you overcrowd the hospital, then it's going to make things worse, or even if you overcrowd the ward. Yeah, it means the patients will not recover quickly. They may end up contracting additional infections in the hospital because they are not being cared properly. Right? So it says, okay, where's the evidence? Yeah. So can you see? It says evidence suggests that temporary mismatches. So if you mismatch in the demand and the capacity for beds, is a continuous source of pressure within the hospitals. So you are mismatching the number of beds with the number of patients you are admitting. Now, just to have a clear view that where admissions is done is different from where the beds are actually being managed. The beds are being managed in the ward. Admissions is always in the outpatient department.
Yeah.
Right? So therefore, you can see already how are you going to be running this effectively. You need to involve communication between the ward sister and the admission in charge. Okay. So
Yeah.
yes, I remember we used to have bed managers. Okay.
We still have.
You still have them, yeah?
It's one very famous one.
Yeah, you used to have bed managers. You can't admit a patient unless you speak to the bed manager. Okay. And this is what they were learning. Okay. Now, this occurs when the total number of new admissions is greater than the number of patients being discharged. Okay. That's what he's talking about, throughput. So if we now, new admissions is the demand he's talking about. So demand for beds is created by the new admissions. All right. So what do we need? We need to make sure that before we can admit patients, we need to discharge some so that we have empty beds, so that these newly admitted they can actually occupy the beds. And this shouldn't be a problem, because we have heard a lot of people talking, particularly our prime minister. Yeah. Yeah, well, that's what you were trying to do when you were trying to say, okay, we need to lock down with this coronavirus. And why should we actually lock down? One of the most important vocal things is to protect the NHS. What they are saying is that they don't want to overcrowd the hospital. In a sense, they can have more admissions than the beds occupy. That is not good for the patients. Okay. Yeah. So while there have been much focus on trying to minimize the waiting times within emergency departments, so even in the emergency department, we need discharge planning. Okay. This front end of the process is wholly dependent on the discharge process. Yes, because even if you are taking urgent cases, yeah, urgent cases need to occupy the beds. So bed capacity management is extremely important, and that can only be effectively managed by discharge planning.
Mhm.
Yeah. Right. So it says significant waits within emergency departments are usually just a symptom rather than a problem. Okay. So why do people wait too long? It's a symptom that probably something is not working well within the hospital. Yeah, because one of the reasons why it shouldn't be operated is that there are no beds. That's what they'll be telling you. They don't say there are no doctors. No, there are no beds. Okay.
Yeah, that's true.
Yeah, so the problem and the focus of improvement efforts should be on the discharge process. So if you work on discharge process across the whole hospital rather than in the process within the department, then it should be able to you should be able to succeed.
Mhm.
Yeah.
Yes,
Okay. Right. All right.
this
So
is very
mhm,
interesting
yeah.
because I never looked at it the way you're showing it to me now.
Hmm.
Yeah.
Okay. So that's what he's talking about. Right. Right. So now, if you look at this chart here, okay, so it looks at cumulative bed state across Monday from 0 at midnight. So you can see, okay, as time is going, the admissions are increasing. Now, soon after 7, you will see there's increase in admissions. If the increase in admission, so from about 10.11, sorry, 10.1, you're going to see increase there, which means they needed to have additional beds because there are more patients coming in. Yeah.
Mhm.
Yeah. All right. So in the graph above, from the Department of Health publication at achieving a timely, simple discharge from hospital. This is a toolkit for multidisciplinary team. I've already pinpointed that two things I've said already. Number one is that the admission is done in the outpatient. The
Yes.
bed management is happening in the ward. So
Mhm.
already there, it encourages. If you have to be effective in working better, it means you need to work hand in hand, which means you need to communicate, interact. The second thing I've said is that many of your patients in this country, they are old. As they're getting older, they tend
Mhm.
to have multiple problems. So they have multiple needs. Therefore, requires multidisciplinary team. Because one patient, you find he has got a hip problem, he has got diabetic, maybe he had a surgery for prostate. So you can see each of these requires different people, which
Mhm.
means different professionals. Therefore, you need to work in a multidisciplinary team. So in the same way, when you are discharging the patient, when your discharge plan, you need to think of who are the stakeholders who are going to be involved.
Mhm.
Okay. Yeah. So if you're taking them home, you can see we need to have meals on wheels. I don't know whether they're still there. Okay. So meals
It's
on
there.
wheels, they're still there. Yeah. And then we need to have an occupational therapist. Okay. And
Yeah.
yeah, then we need also people from council who actually provide the financial help. Yeah.
Mhm.
Yeah, you may need a physiotherapist who is going to help to mobility in terms of mobility. Yeah, so that number of different people is like now you have been split into different parts. Yeah. Okay. So there's the dotted lines show the extra beds needed during the few hours when there are more admissions than discharges. Okay, so you can see. So if there are more admissions than discharges, you need to increase the number of additional beds. Where are you going to get additional beds from? Yeah, the hospital might always end up running out. Now, most of these additional beds, they are always for emergency. What emergencies are we talking about? Okay. During my time when I was working in a hospital, now I worked in a hospital here, but not in the capacity of a doctor, but back in my country. Now, the emergencies we're looking at is not simple things like accident. No, we are thinking of things like a plane crash. Yeah, a plane crash, always a plane carries people more than 200. So therefore, if it's going to crash, you're going to have a multiple number of people. Therefore, you need to have a spare capacity so that you can cater for these people. Or, which happened during my time when I was working outpatient in the afternoon on a Sunday, is the derailment of the train. So we are looking at the things like those which involve so many people. So the plane, the train, the buses, yeah, because they pick a lot of people. So when there's an accident, you don't expect one person. No. Yeah. And that's what the spare capacity is for. Okay. Yeah. So it says the solid lines show that moving even just 30% of discharge ahead of admissions would actually reduce the maximum. So you can see here, the number has gone down. Okay. Yeah. Just because of improving the discharge. Okay. So therefore, planning discharges before the peak in admissions is an effective way of smoothing the total demand for beds. So that's why planning discharge is extremely important. Is a strategic tool. It's important to help managing the capacity of beds. As well as considering the discharge process through the day, the pattern of discharge of the week also needs to be considered. It is also possible to minimize the difference between admissions and discharges over the week, and this will have a positive impact on overall bed requirement, in a sense, saying bed management.
In other words, when you talk about the discharge process, this is where you consider the age, the capacity at home, whether the MDT, who else needs to be involved.
Yeah.
That's the process.
Yes, you need to think of so you need to think of when you are going to discharge somebody, there are a number of things you need to think about. So you are sending someone home, okay, which means he was dependent on you. So one of the things you assess is what is the level of dependence, because there are others who are not highly dependent on the hospital.
Yeah.
If someone is highly dependent, you can see, for example, someone had operation and then you wanted them to go home, because if they stay too long in the hospital, they're going to catch infection. Yeah, so now the wound hasn't healed. So you can see you need a district nurse who is going to be dressing that wound. Now, this person might have no one. Maybe the partner died or they were divorced. Therefore, at the moment, he can't cook. You can see you need to work with the what you call it, the council. The council are the ones who provide carers, okay? Because either they provide their own carers or they contract out the services from different agencies. So you need to be provided with food, or if it's already processed food, then you need to arrange with meals on wheels. Okay. Also, you need something to do with the adaptation of the house. As I said, if it now is immobile, he was mobile, you can see how is it going to move from downstairs to upstairs. Okay, where there's
and maybe that's a further assessment.
Yeah. Okay. So all these. Yeah.
Yeah. Okay. Yeah. I mean, in these D2 beds, D2A beds.
Okay. Yeah, so you can see, so you need a number of people to deal with it. So that's why to plan in advance is extremely important, because getting everybody on board is not going to be easy. Okay. Yeah. Okay. Right. So it says it is also possible to minimize the difference between admissions and discharges over the week, and this would have a positive impact on overall bed requirement. Many hospitals still try to manage weekend capacity by discharging large number of patients on a Friday, and that's what we used to do when I was in hospital, because we expected over the weekend people go drink and do all sorts of things. So then we are creating capacity for Saturday and Sunday. Okay, and those patients will be reviewed on Monday and then will be prescribing medication whatsoever. Yeah. Now, discharges then is slow to trickle until Monday morning or often Monday afternoon. This is not the most effective strategy. It often takes several days for a mismatch. It's true, because if those people who have been admitted in the or over the weekend, yeah, if we are going to assess them fully on Monday, we realize that they may need these tests, that test, those tests, and by the time we prescribe medication, will be somewhere around Wednesday, Thursday. Yeah, so you will see that the next weekend is going to be overcrowded. Yeah, because you can't discharge someone who is sick. It's wrong. Okay. Yeah, yeah. But you need to have a planned discharge, which is what you were trying to teach your newly qualified students here, qualified nurses. Okay. With elective care, so elective care is different from emergency. Okay, so elective care is those normal patients who come and then you expect them to stay for a few days and then they're going. Emergencies are those who are come because maybe they have a heart attack or they had an accident. Yeah, that's what we're talking about. Yeah, the elective care is also those you have planned for them to come into the hospital, maybe just for tests or maybe for hip replacement. Yeah.
Yeah.
Yeah, so you should start discharge planning prior to admissions. Yeah, well before. So by the time they're going into the hospital, they know when they're going to get out. Yeah, unless something goes wrong. Yeah, and this allows everyone to focus on a clear end point in patient's care and ensure that all the support processes, which is important, are in place to help the discharge happen. Yeah. Okay.
Yes.
Having a focus helps to ensure that the patients receive all of the elements of care they need and also help to reduce errors and unnecessary delays along the patient pathway. Okay, and in here they like these pathways. Okay, right. So we have 7 minutes. So what do you want me to do? Increase, or what do you want me to do?
I don't know. Is this the only one you have for me?
No, what do you mean on the one? The slides. You mean the material?
Yeah.
Yeah, you have got 3. I've got 3 here. Remember, I've looked at your assignment brief. I've looked at the
lesson plan.
Yeah,
Discharge planning.
Yeah, now within this one, what I've sent you, you have the links which you'll be able to access yourself.
So, which means I just click on this link again?
No, when you receive it, okay, I'm going to send you where I get this from and the date when they were accessed, because it's not you who provided it. So what you do, you go on that link, then you're going to find this, and there are going to be more other notes which will help you to broaden your understanding.
All right.
Yeah.
So I just click on your name again on your link. Then I go.
No. I will send you via email. This they will be attached to my email.
Aha. Okay. Dr. Fury.
Yes.
This placement I'm on, I'm really tired.
Yeah, I know. Don't worry.
And then we have all these assignments.
Yes.
So much is happening at the moment that, and I've been doing e-learning at the same time.
So, yes, don't worry. Yeah, I will send you. So what I'll do is this. So this, because it's me who you needed this difference. Okay. Now I'm going to send you the link for this. Okay. And there's going to be the date when it has been accessed, because that's what you need. You need those references. Okay. Now, when you click that link, it's going to take you to this document, which we are looking at now. Okay. Then within that particular website, there are other links which, if you want to learn more, they are discussing more, so you get more knowledge of why discharge planning is extremely important. And you can see now from what we have discussed so far, it's extremely important
and very, very helpful, because I didn't think the way you have taught me. Yes.
Okay. So now here, and so okay, I will increase it. So I'll increase the time, because now, unless you are going to go away, that's what I wanted, because I don't increase and then you disappear. because they can only be increased by half an hour. That's what they are in slots of half an hour. Should I increase to half an hour?
No, I will need that time.
Okay, so let me just finish this bit then. Okay.
Yeah.
Now, how to use it? Okay, so now remember the whole of this. They have told you what it is. Okay, so it is a tool that is used by the nurses, so that it helps them to discharge. They have said somewhere. Okay. Yeah. So they are saying how is it used? Okay. There are some key elements when you're planning for discharge, regardless of whether a patient is receiving emergency or elective. Elective, they are always inpatients or day case. Okay. Care. These are, so you can see that helps you in your teaching that you're going to give to your students. Okay. Specifying a date and the time of discharge as early as possible within a period of care. Identifying whether the patient has a simple, a simple or a complex discharge planning needs. Remember, these planning needs are what other care services they are needed at home when you send the patient home. Okay. Identifying what individual patients' needs are and how these needs will be met. Defining the specific clinical criteria that a patient must meet for the discharge. And these are some of the intended learning outcome you want your newly qualified. This is what them to know. So you can put these as intended learning outcomes for your training. Yeah. Okay.
Thank you.
Right. So the detail below focuses on key elements of planning. Okay. So you can see, for elective discharge for simple discharges, but the approach is similar to day case and the simple emergency admissions. This is just a summary. Okay. So we said, for example, there's emergency, there's elective, then expected date of discharge based on anticipated length of stay. And then you may have simple discharge, you may have complex discharge. If it's a simple discharge, patient meets all the clinical criteria for the discharge, which you have said those clinical criteria. Here, patients meets the clinical criteria for discharge. So the most important here is that both of these need to be met before you discharge the patient. So you can ask them your students to ensure that they have understood to develop something like this. Yeah.
Develop a discharge plan.
Yeah, develop discharge plan, and they need to include this. So they try to ask what would be the clinical criteria that you want. Yeah.
Yes. And I can also ask them to not just the discharge plan, but also the how to use the tool.
Yes.
How to use the tool.
Yeah.
How to use discharge tool.
Yeah.
Okay. Sure. Yes, thank you.
Right. Okay. So you read the rest before we cut, because the moment you start cutting, we can't stop it. Yeah. So I'm sure it makes sense. Okay. Yeah.
Yes.
They have given you examples. Okay. So which means you need to pick some from here. Right. So like this one here, examples. Example of criteria for discharge used to well performing. So independence in washing, dressing, and mobility. Safe negotiation of stairs. Remember, I was talking a lot about stairs. If necessary, has he got a clean wound? Because you don't want to send someone where the wound is infected. Okay. Is eating and drinking? Yeah. Then obviously has an X-ray being performed if after operation to make sure that the X-ray obviously shows that everything is fine. Okay.
I can give them that question as well. Give me examples of this. There's also the activities.
Yeah.
I have 3.
All right. Okay. All right. So I'll email you this now. Okay. Before.
Thank you.
Yeah.
So does that stay with me whenever I want to access it?
What? This thing here?
What you email me?
Yeah. Yes. You can print it. You can do whatever. Those you can save them on your desktop. That's all. You're going to have them. Yeah. They are your copies. Yeah. They're not going to disappear. Okay.
Thank you so much.
But they're going to be in attachment. The attachment, they're at the bottom there. You can open them. Okay.
Thank you so much.
All right. You take care. Okay.
Thank you very much.
Okay.
Take care.
Information here tomorrow about how to access the video. Okay.
Thank you. Then take care.
The same to you. Okay. Bye. Yeah, bye.
Bye bye.